do want to continue, though, with our investigation into the death of a teenager right after her stay at Newport News Behavioral Health Center. We've been exploring the death of 17-year-old Raven Keffer for 2 months now. Investigative reporter Chris Horne has exclusive results from a damning state inspection of the center and talks to one of the center's employees who cared for Raven. Chris.
Anita, the staff member's shocking account, corroborated by 3 other sources, by the way, aligns with this state report. It says the facility failed to provide Raven with appropriate services and treatment. And our source says red flags were ignored and Raven was subjected to needless suffering.
She suffered in every way, in my opinion. Physically, mentally, emotionally.
A mental health technician with 20 years of healthcare experience says the case of Raven Keffer was badly mishandled. And so does this state report we just received over the weekend. It says the Newport News Behavioral Health Center failed to comply with 13 different regulations in the case of Raven Keffer. The 17-year-old had just spent 8 days there, hours before her death at a hospital June 29th. The employee says the center's nurses dismissed Raven's pleas from the time she arrived.
She wanted to go to the hospital. They said she's faking. There's nothing wrong with her. She said she's throwing up blood.
The employee says the nurses were dismissive of Raven because they thought she was just trying to get pain meds. Her family members are furious.
The people that ignored her plea for help, I mean, they should be, liable.
The report from the Department of Behavioral Health and Developmental Services cites the Newport News Center for depriving Raven of appropriate services and treatment, for failing to document her significant medical concerns and failing to note her health complaints. Raven's condition worsened to the point where she needed help walking.
The nurses would roll their eyes and again say she was faking.
The day Raven later died, her pleas for medical help got more urgent, but the technician says nurses were not calling 911. Even another young resident noticed that Raven's condition was dire.
The other kid actually started screaming that, her pupils were dilated and y'all need to call 911. I told the nurse again, you need to call 911.
Raven had virtually no vital signs and she began to urinate on herself. A nurse agreed to get Raven to the hospital, but only on one condition.
She needed to get up and go change her clothes first.
If she was doing that to herself, then she had to be really something wrong.
The employee says at that point, another nurse intervened.
And she stepped over top of her like she was a dead dog and said, move, watch this, I got this shit.
The health tech says that second nurse broke open 2 ammonia packs.
They were still saying she was faking. If she was faking and you put ammonia pack under somebody's nose, they immediately, there's a response. There was nothing.
According to the employee, the vitally needed 911 call was finally made, but not by a member of the staff.
One of the kids on the unit had gotten the cordless phone and they were on the phone with 911.
Court records show that Newport News firefighters arrived about 6:30 that evening and transported Raven to a hospital. By 10:30, Raven was dead.
It's not that I haven't watched people die. This kid sat there for 5 days begging us to help her, which is what we were supposed to do. We were forced to believe that she was just a drug addict.
If she was in the hospital, at least she could have been comforted or, done something to help her, not just let her lay there and suffer and die like that.
Center's CEO says he could not comment on specifics, citing HIPAA privacy laws. But CEO Paul Kirkham says the center has received the state report that I have in my hand and is cooperating with the investigation. The cause of death for Raven Keffer officially remains undetermined. Chris Horne, 10 on your side.